All right, so I am here with Dick from Ergotron and Aline from Ergotron. Welcome. So Dick, I'll start with you. So what are some of the key trends that you're seeing in the healthcare space, and how is Ergotron addressing these?
Well, I would say the increased use of telehealth or virtual care is one for sure. So what we're doing is making sure that both our mobile and mounted point of care solutions are really sufficiently adaptable to also be used as telehealth endpoint solutions. So sometimes that might be as simple as just adding a shelf or other support for a webcam or integrated web conferencing solution, or coming up with an entire card solution for a mobile telehealth endpoint. But the key consideration for us really hasn't changed. It's how can we best position the technology to support the intended workflow.
So Aline, how about you? So what are some of the key trends you're seeing in the healthcare space, and how is Ergotron addressing these?
So one of the other things that we've seen and observed is sort of a focus around expansion into ambulatory environments. So all of those facilities that are sort of ancillary to your traditional brick and mortar hospital. And then kind of the design trends that go along with that. It's, trying to get people out of the traditional ED and get them out into their primary care provider's office or into an urgent care facility or standalone ED or something like that. And as part of that, the design and the construction trends that are kind of shifting in that world have been interesting to follow. It's definitely more towards a term that we've heard used is residential. So almost creating more of a hotel type feel or a more comfortable feel in those spaces. And so there's a lot of construction and expansion happening in those areas, and that's driving a lot of spend on products that are more specific to those types of workflows. So, not your big traditional med carts, for example, that you'd see in a hospital, maybe more low profile wall mounts that are better suited for a small exam room. And then obviously the fit, form, and finish that goes along with that. So we're definitely seeing that as well. a lot of activity around ambulatory and wall mounts specifically.
Yeah, so Aline, just to follow up on that. I mean, that was kind of one of my other questions, was just about, when we think about solutions, right? If I'm a partner and I'm thinking about a solution, it's not just about a hospital, right? So healthcare is lots of different market segments, and that's basically what you're seeing out there, right? Ambulatory care is one of the more common pieces for that.
Yeah, and I think that's one of the things for me that's so exciting about selling into healthcare, and specifically selling into healthcare for Ergotron, is that a healthcare enterprise is very unique in that it really encompasses all kinds of different little micro customers and markets within the walls of their institution. If you think about the fact that there's traditional point of care, nurses and doctors and everything that they do to care for patients, but you also have back office workers, people like us that sit at desks and work all day. You have, AV, so you have large format displays and digital signage that are, sort of finding a much larger footprint inside of a healthcare enterprise. They're, radiology, observation, remote patient monitoring, telehealth, as Dick mentioned. There's so many different ways that the Ergotron portfolio touches the healthcare enterprise, which translates into a tremendous amount of opportunity for partners to sell our portfolio into healthcare, because there's a very wide breadth of product. So ambulatory is just one of those things.
Right. So Dick, what is different selling into healthcare today than it was? I'll start with 5 years ago in case you want a sort of an open area. But if you want to say 2 years ago because of the pandemic, answer that way as well. I'll leave it up to you. So what
Well, that's the obvious
what's
one.
changed? Yeah.
That's the obvious one, obviously, is the pandemic. So certainly over the last almost 2 years now, that has definitely impacted selling into healthcare more than anything else. So for us, we lost, much like our partners, we lost the ability to be in front of our healthcare customers physically in an environment with a product where on-site consultations were often critical to the sales process, and also our solutions and key to experiencing our brand was hands-on with the product is one of the strongest selling points, if you were. So that ability to feel the difference, so to speak, was kind of taken away from us. So, however, there's really been a positive outcome to that in some regard, as we were forced to work on a virtual basis like everybody else. We needed to be a little more creative. This actually led to the development of our clinical showroom, which you see in the background now, to support virtual product demos, something we'd really never done before because we were doing those live on site. So we kind of asked ourselves why it took so long to do that, because it really led to the ability to do these things virtually that was easier to get people together in some cases. We were still able to get a lot of interaction. And so moving forward, we expect this showroom to really be a part of our sales tool bag, if you will, even as we get back to whatever that new normal is. And I would point out that that's a resource that's also available to our reseller partners. So working through their local territory account manager or through their channel account manager, we can schedule that and allow them to bring their customers into that showroom. We actually have our clinical person in the showroom that's a nurse and can help not only demonstrate the product, but also offer the clinical perspective to a lot of our products too. So again, that's a capability we didn't have before we had the showroom. So while COVID overall has been a huge challenge for us, it really led to a selling tool that will benefit both us and our partners long into the future.
Yeah, sort of the good of COVID, right? Sort of not, and what you're saying is just sort of one example, right? That's happening in many different ways out there, right? Companies doing things in new ways. They're like, well, why didn't we always meant to do this. We're finally forced to do this, and hey, wow, it was a good idea. Change what customers expect, right? All that stuff sort of is changing as we go here. All right, so Aline, how about yourself? So, from your perspective, selling into healthcare, let's just overall just say the last 5 years. What do you think's different today than it was 5 years ago?
Yeah, I mean, obviously, sometimes it's hard to just like block COVID out of your brain. I can't even. There are days when I really can't even remember what life was like before the pandemic. I'd say in terms of how that kind of translates into how we approach our, sales process and our engagement with our clients, I would say it's still pretty much the same, except that there are sort of new things to consider. And I'll give you an example. Because of COVID and obviously an increased focus on cross-contamination and infection control in hospitals. Not that hospitals weren't concerned with infection control before, because they certainly were. COVID has changed that a little bit because at a very basic level, for example, every time a nurse goes into a patient room with suspected COVID, they have to gown up, right? So there's a lot of PPE, there's a lot of time and cost involved in that interaction. And so something as simple as that is kind of forcing people to rethink what we always thought were our norms, which are, the goal would be get the clinician into the patient room as close to the patient as possible so that they can have that really intimate interaction. Well, now we have this kind of new complexity that we have to consider, which is we may not always want to take the clinician into the patient room that close to the patient every single time. So do we or can we enable additional ways for that clinician to engage the technology in the spirit of patient care, but do it in a safer way? So like, do we take them back out into the hallway? it's interesting because we spent a lot of time before trying to force the clinicians into the patient room. Nursing leadership would try to force the clinicians into the patient room to engage with the patient, because that's ultimately what results in the best experience for the patient and reduces the risk overall of any kinds of, medication errors or things like that. Now it's like, oh, we might have to kind of backpedal a little bit on that, because we need to give them the option to compute in the hallway or be mobile so that they can actually stand just outside of the doorway or something. So little things like that are new things that we have to consider. And every institution is a little bit different in their approach. So one size doesn't fit all. What works for one facility may not be the philosophy at the next facility. So it places a little extra burden on us to try to understand going in where their priorities are and what's really driving their decisions around workflow and safety. So
one other thing, if I might add, that if I go back in my Wayback Machine, so it's kind of like Aline said, it's tough to imagine the time before COVID now, but if you think about 5 years ago and where we were with technology adoption today is happening much faster. So think about something as basic as the form factor. A mini form factor 5 years ago was kind of the red herring. You didn't see them very often. Today, it's become the standard, especially in healthcare. And there's a lot of advantages of that with mobile applications and such. So for us and for our products, and when we look at that, the ability to be nimble or have flexible, again, the open architecture type solution our products bring becomes more critical so that you can adapt to that, not only as you're deploying today, but when that technology changes in now 2 to 3 years. I'll even take the leap back, and kind of reveals my age. I've been doing this a lot longer than just the last 5 years. But before, when we first got into healthcare, it was kind of unthinkable that there would be a refresh of our product, or even hardware, more than once every 5 years. Now, typically 3 years is a standard. And part of that's driven by the fact that technology changes so much in those few years. So I think that will probably just continue, and something that needs to be considered even when mounting or positioning equipment in healthcare settings.
Okay, so you're saying a changing in the life cycle that's acceptable within that space, essentially. Yeah, interesting. All right. Now, Dick, I'll give you a chance. I think Aline kind of already answered it, but the other sort of high level question would be, when you think of healthcare solutions, do you always think of the hospital, or are there other market segments that you think are key to think about when you're selling into the space?
So there really are, and candidly, a lot of these are outside of healthcare. While our products are designed and kind of optimized around that, due to the professional grade nature of the products, they lend themselves into other markets such as industrial or manufacturing lab environments. But looking just within the typical healthcare space, if there is such a thing, we joke about this. If you get outside of the typical healthcare enterprise, or that you think about a healthcare campus, really our market, as we define it internally for healthcare, is anyone that sees patients, two-legged, four-legged, dead or alive, is really how we encapsulate that. So when you start thinking about dental offices, veterinary clinics, really any place that is implementing electronic medical records, there's an application for our products at the point of care. But then going beyond that, as Aline said, since it's not just point of care where these are applicable, there are certainly other opportunities, not only on the office side of those things, but laboratories, things like that. We're using technology in all environments. So really, wherever there's use of technology, potential application for our products. So with movement at the core of what we're trying to do there to adapt the workflows, provide ergonomic adjustability, again, that applicability is really far and wide.
All right. So hearing the word workflow, yeah. So we kind of in the BTC here, we kind of created sort of a list of things like thinking points when you're selling in for a full solution into healthcare, right? And sort of it begins and ends with doing assessments into the space, like different types of assessments. One of them is safety, and Ergotron plays a little bit there, right, with some antimicrobial, some UV lighting, I think was recently added, as well as reliable infrastructure and security. But the other one is workflow, right, and how our product fits into the workflow, right, as we, at least we like to say workflow is king, and if your product doesn't fit into the workflow, then you're not going to go anywhere, right? So I guess my question to you, if you want to touch on safety or something like that, you certainly can. But my question is, and I'll start with Dick. My question is, how does Ergotron fit and perhaps enhance a given healthcare workflow?
So that, and you come back to workflow, and that's kind of at the core of what we're looking for there. So really our goal is for our solutions to allow the caregiver to position the technology to best support whatever that workflow is. So our goal is to support what we call the physical triangle of care between the patient, the caregiver, and the technology. And so that's really at the core so that it keeps the patient experience at the center of care. But it also then makes the computer access needed to support that workflow as efficient as possible. So not only for that workflow, but the overall care process. But back to safety, another aspect of that's the ergonomic adjustability it provides, so that given the clinicians that are, as we all know, often work long hours and overwork, our solutions provide ergonomic adjustability so that we can ease that stress as they go about the workflow. So there's kind of that practical implementation around the triangle of care, but then what are we doing to help support the caregiver to make their daily lives easier?
All right, Aline, so how does Ergotron fit into and perhaps enhance a given healthcare workflow?
Well, I guess another way to look at it is that I'll tell you what we don't want to be. we don't want to be an impediment, right? We don't want to be the thing that slows a clinician down or makes a clinician uncomfortable or makes them less efficient or productive. So, just I think Dick summed it up nicely. I think that we ultimately want our product to kind of just like disappear into the wings. If they're talking about our product too much, it's probably not a good sign. I like to describe it to people who know nothing about what we do as we're kind of like the delivery vehicle, literally and figuratively, for the technology. So we're the ones bringing that technology to the point of need, which in some cases in healthcare can be, right there at the patient bedside. In other instances, it's at the desk of the AP clerk or the CNO, or sometimes it's the laboratory, sometimes it's the pathologist in the grossing room. We're bringing that technology to the point of need. And I think one of the, kind of going back to the value that Ergotron offers is, being able to provide the flexibility to adapt our products to those different workflows is pretty important. So, we kind of have our core product families, but within each one of those, you can customize them and tailor them based on those specific workflow needs. So if there are specific peripherals that are required in one workflow, but not in another, you're not stuck with, a one size, again, kind of that one size fits all sort of mentality.
All right. Let the workflow, right? Is how you assist the workflow. So, Aline, if you might, so if you put your shoes, put the shoes of a partner on for a moment, and if you were engaging with an end user, what sort of probing questions do you think are useful for a partner to ask, right, to maybe open up some of these sales opportunities? So,
I think some of this is sales 101, right? But what are your priorities? What are you focused on? What challenges are you facing as a result of COVID? What's a really difficult workflow problem that you're trying to solve, and how can I help, right? I think all of those things sort of start the conversation, but and you're going to get a myriad of answers, I would expect, when you ask a hospital those questions, because everybody's facing different challenges. Some of them are facing all the same challenges. Obviously, everybody's dealing with COVID, everybody's dealing with budget cuts, all that stuff. But trying to get at the specific workflow needs and maybe gaps for them is where the partner, and where we try to find add value is What's that one thing that you just haven't been able to solve for? And can we solve for it? So we spend a lot of time doing walkthroughs with clients. And I just wanted to add, this kind of dovetails back to what Dick was saying about the clinical showroom, but the partners don't need to be experts on our products. There's just no way that they could be. It's complicated. It's kind of a long sales cycle. Again, there's hundreds and hundreds of SKUs and lots of different ways that you can position, build a solution. So to that end, I think the biggest thing is for them to make sure that they engage us so that we can help them ask those questions and we can help them with the workflow assessment or the walkthrough. Because it can be a little overwhelming to try to go out there and do that yourself. So, in addition to asking the right questions, I would say the biggest goal for them would be to get in front of the customer, get on site, see the space, try to get feedback from the clinicians about what they need and what they're looking for and what would make their lives better.
So Dick, just, what are your thoughts if you were just sort of trying to give some advice to a partner, maybe to ask some probing questions to help sell Ergotron into the healthcare space?
I think one thing, and this is just a little bit of a deviation on something that Aline said, but given the opportunity to talk to the caregivers themselves, which is ideal, and sometimes coming in the front door right off, you may not have that opportunity, but even a nurse manager, wherever that kind of guides that need, asking them for the pain point in their current workflow, especially as it involves technology access. We're in a mode now where they have a workflow established. There are solutions in place, and many times they've been using that for some time. Is it working for them? And if not, what is it? What is the impediment? Because that's the other thing we're looking for, is to remove constraints. That's part of our overall vision as a company. And so in healthcare, that can be one of the things. And it sounds kind of simple, but nurses are typically very vocal. They're willing to share that with you, but that can be insightful. Maybe the solution should be wall mounted versus mobile, or vice versa, or the solution they have doesn't provide the articulation they need. Again, going back to that triangle of care to create that, forces them to have their back to the patient. That can be awkward for them, and it also diminishes the patient's experience. So hitting on those things then can uncover, potential opportunity for our product. And the breadth of solutions, while Aline mentioned, can be kind of overwhelming. It's also one of our strengths, and we really focus on, providing a solution for a given situation, rather than here's a product that we're trying to force into the application like a square peg in a round hole. So.
All right, terrific. Yeah, I would think a lot of things we might even run into where people didn't realize they had a feature or something like that. Like, oh, this keyboard tray moves all the way over here, so I don't have to stand in front of the display, or oh, there's a light in front of the keyboard, so I can type at night. There's lots of little features in there, right, that make a big difference to an end user if you can uncover that, right? Or are there issues at night? Those types of things. All right, interesting. All right,
and I would just add to that too, that we could potentially, on the walkthrough that Aline mentioned, just given the experience that our territory account managers have in knowing those solutions, sometimes it's just the opportunity to present to a caregiver the what if you had a solution that would do this or that, would that make a difference to you? And
right.
Sometimes that's the light bulb, kind of to your point. They didn't even realize that was a potential to have. So that's the advantage of being able to see real time how that workflow works and the pain points, what they might be.
Now, one of the things we like to focus on in general is the idea of value and adding value. So we get a little more in detail here. Is there something like that's an Ergotron MVP, something that you've seen just that really adds a lot of value, or has in a given situation added a lot of value?
I think in a broad sense, we talked a little bit earlier about the breadth of products, which is certainly a huge value when we come into application, because we're not just locked into one or two horse kind of solution. The more important across the product lines is probably Ergotron's professional grade nature of our products, which for us kind of comes on three primary tenets, one being human-centered design, the second being engineered ergonomics, and the final one being really just an uncompromising quality and safety focus on the products. What that gives the customers not only a solution that works for them now, but one that's going to be durable, that's going to be there for many years to come. There are admittedly less expensive solutions in the market. This is one of the areas where you really can get what you pay for. And so I think that we bring across the products and we have that brand recognition associated with that value in the market is probably one of our MVPs.
All right, Aline, what do you think? Do you think there's what is it that Ergotron provides that you've seen has delivered the most value to their customers, either generally or in a specific instance?
Well, I think Dick covered that really nicely. Just to kind of build off that, I would say, and this is a benefit for any partner that's selling our products, is the confidence in knowing that you're selling not only arguably the most well-known and the most, kind of the largest vendor in this space, but the product quality and durability is something that I have always really appreciated at Ergotron. Much to my chagrin, some of our products last a really, really long time. It makes it hard when you want to refresh. But I also really, really appreciate knowing that my company and their, and as an extension, I can really stand behind the product from a quality perspective. That feels really, really good to me. And our customers will tell us that over and over and over again. The only other thing I would add is that, I don't know if this is exactly what you were after, but I think it's really important. Our people make the difference at Ergotron. We have an exceptional team. Our field salespeople are exceptionally committed. They are hands-on. They are knowledgeable. I like to say that we don't have a field sales team made up of a bunch of kind of cheesy, high pressure people that are going to come in and embarrass you if you're a partner bringing us in. We truly try to be trusted advisors, and that's how we like to portray ourselves. Not that we don't like to sell things, we do, but for us, it's more about finding the right products and the right fit. And sometimes that, by the way, that means saying, I'm sorry, I don't have a solution for you. It's rare, but there are times when we can't make it work, and you need to do right by the customer in that instance and say, I think that you might be better served by a different solution. So I think our people is kind of just to add on to that, the cherry on top. So
all right, so Aline, do you have a personal favorite? Like, is there a feature either that it's just one of your pet favorites, or maybe it was when you first encountered something, like when you first started at Ergotron, something like that, you're like, oh, this is great. So what's your personal favorite?
Probably it would be Constant Force, which is our patented lift mechanism design. The way we use CF across all of our products is really cool. It's different, and the experience is even different from product to product to some degree, but the net result is that you get this sort of effortless kind of adjustment experience. And so to me, when you look at Ergotron products side by side with competitors, even if there are a lot of similarities visually between the products, once you start to move them and work with them, you really see the difference. And I think a lot of that does have to do with CF, as simple as that sounds. But when you consider that ergonomics and the ability to sit or stand while you work is kind of at the center of everything that we do, that CF then becomes really, really important. It's kind of, again, it's central to all of our products. So I'd say CF is a huge differentiator for us. It's probably, when you think about it, it's probably the difference maker. So.
All right, Dick, how about you? Is there a pet that you have? Is there a personal favorite Ergotron feature or product?
I'm trying to think of a new one off the top of my head, because as soon as you ask Aline, that Constant Force comes to my mind as well. For all the reasons she said, it's at the core of almost all of our products now. For me, I have an engineering education background, so maybe that's part of it too. The nerd in me likes it. But the other key things about it is that the physics principles behind it are actually limited to be adaptable in a number of different applications. So it's not just one mechanism. There's different ways we've used that, which lets us use that across numerous different products. But the other thing is, in comparison to the solutions that are out there, most other solutions either use just a simple one-way, like pneumatic spring, or some kind of a gas spring. And the other big advantage constant force brings is it's going to outlast that. Even the best gas springs, eventually the seals wear, they depressurize. Sometimes you can adjust them to kind of chase that for a while, but ultimately then you no longer get the force out of that spring that's key to that, the counterbalance, if you will. So with constant force and relying really on a compression or a coil spring at the heart, we usually tell customers until that rusts through, by which time I hope to be in the ground, you're going to have a solution that works. But it's also much more functional, as Aline alluded to, much smoother, better user experience as well. And so you'll see that across almost all of our products.
I'm going to wrap it up here, but I just thought I'd ask if there are any use cases that are sort of success stories in the healthcare space for Ergotron that you'd want to mention.
I think that we've been able to excel here recently in putting together effective solutions for registration workflows, being able to add multiple peripherals to a mobile cart. It's something that, when we designed our carts, and probably most of our competitors, we kind of never dreamed that somebody would want to put all of these things onto one cart. And I'll spare you all the details, but it's like a ton of different peripherals that they want to have with them, that they want to push all over a hospital 24 hours a day. Being able to solve for that kind of tricky or niche-y workflow feels good, right? We recently had, we won a very, very large system-wide cart standard that was born from a desire to solve for a registration workflow. And it was kind of interesting because we didn't know that we were competing for the broader business at the time. We thought we were just competing for the registration cart business, but because we were able to solve that problem, we demonstrated our value, not only for that specific project, but as an organization, and therefore kind of were, very pleasantly surprised by the fact that meant we were going to get a lot of follow-on business. So I think that was an interesting story, and kind of
is interesting. So how many devices would you say connected to a cart? Like 10 or something like that? Or
it's like 4 AC powered devices.
Okay.
So between your monitor, your PC, your, now I'm drawing a blank. So you have an AC powered document scanner, you have a monitor, you have a PC, and then there's a fourth thing, and I'm trying to remember what it typically is.
So they came up, they're just adding things to their solution desk.
And then there's
right?
also
And
multiple USB.
to keep it mobile.
Yeah, multiple USB peripherals. So a credit card reader, a signature pad, sometimes a tablet. Like there's all these other things that they want to have with them on that cart. And it just starts to get really unwieldy. And, so that we solved
found
the
a way to
problem.
make it work.
Yeah.
No, it's a great example.
Yeah, so I've forgotten my other example now. So let Dick add one. He's got one.
Dick, anything to say for yourself, or you?
Well, I would take a little different twist as I was thinking about that, and it's a capability really, and it has to do with our production capacity, supply chain, and our distribution network, and including Ingram. The ability to have product in the barn, so to speak. It's really fun when a customer comes to you that's down to the wire because either the competitor wasn't able to deliver, or for whatever the reason, they're down to the 11th hour, and we can actually fulfill the order and get the solution in place, whether it's shipping right out of Ingram because it's available, but even our production capacity in Egan, where we assemble our powered carts, we've been able to manage our supply chain to keep production capacity open in a relatively short period. So that means when orders drop, we can get them into production really within a matter of days, where traditionally there's a backlog of orders already in front of that. And so the ability to maintain that and deliver, that's really fun for a customer that really thinks they're not going to be able to get a solution. And we've candidly had some situations in the past couple months where our ability to deliver too fast was the problem. It was not just too long. We were able to deliver before the customer was really ready for it. So much easier to manage than when you're taking longer.
Okay.
Such
great.
an important, yeah, actually, I'm really glad you said that, Dick. That's very important.
Mhm.
And also just, in that same vein, our commitment to the channel, right? We have always
Sure.
been, an indirect company. So partners don't have to worry about us, coming out and selling direct to end users or something like that. So we very much value our channel.